At Boise State Public Radio, you can listen to all of our podcasts free of charge. We don't lock any episodes. We don't require subscriptions, nothing like that. But the truth is, although our podcasts are free to listen to, they're not cheap to make. A lot of time and resources go into bringing you the daily news on The Connector, statewide voices on Idaho Matters, and the long-form journalism in podcasts like Scandalized, Extremely American, and Mustang. That's why we're asking, if you can, please consider supporting Boise State Public Radio podcasts today. We have a lot of work planned for 2025. Yes, new podcasts, but none of it would be possible without the generous support of our listeners. Every gift matters, whether it's $5 or $50, whatever feels right to you. Head to our website, boisestatepublicradio.org, and click that blue donate button. If you're giving to support podcasts like the one you just hit play on, leave us a comment with your donation and let us know. Your support will help make sure these podcasts keep coming and remain free and accessible to everyone. Thanks so much for listening.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Throughout the past year, Idaho Matters took a deep dive into how our changing climate is impacting our health. So how important are trees and green spaces to keeping us healthy? What do the toxins and plastics do to our bodies? And how can we reduce them in the landfill? And what impact does our healthcare system have on our climate? These were all questions that we wanted to explore this year. So we've gathered those conversations together in our series, How We're Adapting to a Changing Climate. So join us as we answer this question and find out ways to make positive change to our health and to our planet. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. It's no secret that climate change is impacting our landscapes, but did you know it's also affecting our health? As extreme weather events become more common, so do threats to our air and our water, even our food quality, all of which creates a domino effect. So understanding the consequences of these stressors is really important, which is why St. Luke's Director of Sustainability, Dr. Ethan Sims, joining us now. Dr. Sims, it's really nice to have you back on the program.
Thanks so much, Gemma. I appreciate the opportunity.
So can you start out kind of by setting the scene for us? Can you talk about some of the extreme weather events that we've been seeing more of in recent years?
Yeah, I don't think you have to think too far back
to
understand what I'm going to be talking about, because this summer really was an awesome display of how our environment and climate have changed in a way that is really negatively impacting our health. I think everyone can recall the incredible heat we dealt with sort of late June, July, and into August, where we had record-breaking numbers of 100-degree days, just day after day, where it was hotter in the peak times of day, but also not really cooling off as much as it used to. So instead of those big 20 to 25-degree drops you'd see overnight, we weren't quite seeing that same degree of cooling off. So it made it really hard for people to get a break from the heat. And then that led right into one of the worst smoke seasons we've had in a long time, where, the whole Sun Valley, Garden Valley areas were just devastated all summer long with really terrible air quality. And I can say from, working in the emergency department, we were seeing lots of people come in from a small community like Garden Valley with respiratory conditions, but not just the typical respiratory things you think of. We were also seeing people come in just flu-like symptoms, weak, fatigued, itchy eyes, just didn't feel well and couldn't put a finger on what it was, thought they had COVID test negative. And I think that's a lot of what we're seeing with smoke-related illness.
Mm-hmm. So with that said, I'm curious also about, not just the physical health, as you said, all of these symptoms that are presenting at ERs, but how about mental health? How is that impacted? Because I have to tell you, I remember towards the end of the summer, I was cranky and being like, it might as well be winter. Like you can't even be outside. You can't enjoy summertime. So if we're going to be stuck inside, it might as well be cold. So what about our mental health and how that is impacted?
Yeah, I mean, I think it's multiple ways. I think there are direct mental health impacts of especially wildfire smoke and heat to a lesser degree that affect your ability to concentrate, affect your mood because of the physiologic changes to your body during the times of extreme heat. and also some long-term effects like increased risk of dementia and cognitive decline with repeated exposure to wildfire smoke. But I think the thing you're thinking of is that what we call solastalgia, the sort of loss of your normal environment while you're still living in it, the depression of not being able to do the things you want to be able to do. And I think, most Idahoans have some connection to the outdoors, whether it's because they hunt and fish, because they mountain bike like I do, because they UTV. But all those things become less and less feasible when the heat is really high, or the smoke is making it so the air quality is so bad you can't go out and do anything because you just can't breathe. And so instead of doing the things you love, you're sitting indoors. And we know that when human beings go from a state where they're out engaging in something they enjoy with other people to withdrawing indoors, often by themselves and turning instead of to a friend but to a screen, that is really harmful to your mental health,
Mm.
and really harmful to societal health. I think that's where a lot of the broader societal divisions we're seeing come from, where we're withdrawing from each other and just focusing on screens and indoor time. And I think the environmental changes we've seen recently have really driven a lot of that.
Are there people who are at greatest risk to these climate related hazards or illnesses?
Yeah, we certainly think of the most vulnerable, and we think of this as a health equity issue. And I think when people hear equity, they think of lower socioeconomic status patients, which is certainly true. People that live closer to an event, closer to a highway, are more likely to experience poor air quality. People that can't afford good indoor air filtration systems are more likely to have toxic air in the houses that they're living in. But I think the population that we often overlook is older patients, and the
Hmm.
seniors in our community. So, our parents and grandparents, especially those who are in communal living situations like an assisted living facility, um, oftentimes don't have great indoor air quality, and they don't have access to the outdoors to get out of that bad air quality. So there were some studies done by a professor at Boise State named Luke Montrose, who since moved on to Colorado State, looking at air quality in senior living facilities during the time of COVID across the state, and really found that there were really poor indoor air quality levels at most of these places. Um, and again, these are populations that don't have a lot of control over their ability to get outside or get away from that exposure. Um, so that's a very specific example, but I think
Hmm.
generally speaking, it's the very young, the very old, and those who don't have access to resources.
So, are there also kind of like less obvious effects of these climate issues that we're seeing? I'm thinking like the spread of insects because you have warmer weather, right? Which could then lead to some long term illnesses. Can you talk about that?
Yeah, absolutely. We host a lecture series at St. Luke's on climate and health that's partnered with an organization called the Idaho Clinicians for Climate and Health. And Idaho Matters has been gracious enough to host a number of our speakers in the past. But we had a lecture from Dr. Chris Hahn and Dr. Sky Blue, two infectious disease physicians in the state of Idaho. And they talked about what we're seeing locally and globally on this issue. As the climate changes, the vectors, the insects that carry these diseases and can transmit them, spread further and further into areas they've never been before, with these vulnerable populations that have never had exposure to these diseases. Um, Things I think of in our region are things like Rocky Mountain spotted fever, which is becoming a more frequent occurrence in Idaho, has been here for quite some time, but is getting more common. Lyme disease, which has not reached Idaho yet, but has migrated from its traditional home in New England all the way as far west as Minnesota.
Hmm.
Um, I moved here from New Mexico in 2017, and New Mexico had several cases of dengue fever in the past couple of years, which I would certainly typically have associated with tropical environments. And I definitely don't think of Albuquerque as a tropical destination. And then last year we had several cases of malaria with native transmission. So people that had not traveled outside of the state coming down with malaria in Florida, Maryland, and as far north as Massachusetts. So these are diseases that we're not used to seeing. And physicians in these locations are not used to identifying, which makes it really hard for us in the healthcare community to know what we're up against sometimes when, like I
Mhm.
think if you're in New England and you see a rash that's typical of Lyme disease, you know exactly what you're dealing with. If you live in Idaho and you haven't seen Lyme disease since you looked at it in a textbook in medical school, it's going to be a lot harder to make that diagnosis.
Mhm. Before I let you go, I think it's fair to say that climate change, the issue of climate change, has become so politically charged in our country, right? And because of that, there is such a back and forth around the politics of it. Why, in your opinion, is it important that we actually need to talk about this issue and be aware of this issue and do something about climate change and, frankly, take politics out of it? I mean, climate change is real. We need to figure this out.
Yeah, I mean, I think the clearest example that climate change is not a political issue, but a healthcare issue came in 2021 in the peak of the COVID pandemic. More than 200 healthcare journals across the country and across the planet co-published an editorial saying that climate change was the greatest threat to human health, while COVID was, just running rampant in our hospital systems.
Mm.
So places like the New England Journal of Medicine, the Lancet, British Medical Journal, JAMA, all these major educational institutions for healthcare came out and said climate change is a bigger problem for our health. Um, so if we can think of this as a public health issue, which when you go outside and you can't breathe because there's so much smoke in the air, you realize that, hey, maybe this is a public health issue. When you want to go hunting in October, and there are no animals left in the hills that you normally hunt because they've all moved further north because the climate has changed so much. You can maybe think of your pastimes as not a political issue, but a reality that we need to do something to change. And so I think everybody's got a reason to care about climate change. Um, but it has become so toxic and so divided that I think we just need to start thinking of it in different terms.
Mm.
And so when I talk about all these innovations that I'm trying to support, like clean renewable energy, I'm talking about it as a health benefit to our community, not as a uh, liberal idea that we need wind farms or something.
Hmm.
But this is something that's going to improve our community health if we get rid of coal-fired power plants that are polluting the air and replace them with clean, renewable solar energy. Um, and a lot of times it's hard to talk about it if you say climate and change in the same sentence. But the reality of most of these innovations is that they're cost saving. And I think if you can focus on the financial aspects of it too, as well as the health impacts of it, you can really find these multiple layers of benefits to environmental initiatives. If we invest in clean, renewable energy, it is way cheaper than investing in natural gas, investing in coal. And it also comes with the added bonus that it has significantly fewer greenhouse gas emissions. So it's going to provide cheaper, cleaner energy that's going to improve our community health. And it just has benefit after benefit that you can really speak to your leadership about.
Well, I want to, as always, thank you so much for taking time to talk with us. We've been speaking with Dr. Ethan Sims, an emergency medicine physician and St. Luke's medical director for sustainability, about the impact of climate change on our health. As we take a look back at 2024, we're exploring how our climate is changing and how it's impacting our bodies and our health. So let's get back to our series, how we're adapting to a changing climate, right here on Idaho Matters. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Boise is known as the city of trees, and despite being in a desert, it has a fairly substantial urban forest. More and more, researchers are finding that trees aren't just beautiful to look at, they also provide health benefits, from lowering blood pressure to even helping babies grow and thrive. And cities and companies are working together to create healthier environments by planting trees. Lance Davison is the executive director and co founder at Treasure Valley Canopy Network. And Jeffrey Donovan is a research forester with the USDA Forest Service Pacific Northwest Research Station. Welcome, both of you, to the program.
Thank you.
Thank you, Gemma.
So, Jeffrey, let me begin with you. I want to jump right in with the health benefits of trees. You've been looking at some studies showing how trees help people, including one that actually found that women with more trees around where they live are actually less likely to have underweight babies. I mean, that's pretty incredible. Can you talk a little bit about that?
Sure, yeah, it does seem like a sort of remarkable finding. And that first study that we did on that was way back in 2011. And, when we found that, it was impressive, but it may have been people see it as some sort of statistical oddity. But since then, there's been as many as 30 studies that have found a link between improved birth weight and exposure to the natural environment, not just trees, but greenness more generally. And what likely is doing that, we're not exactly sure what might mediate that response, but there's a number of things. We know trees can reduce stress. We know they can absorb air pollution. We know they can encourage people to engage in outdoor recreation. We know they can improve social cohesion. Greener neighborhoods have more social connections. And we know all those things can help improve birth outcomes.
So I want to bring you into the conversation as well, Lance. But before we start, can you tell us what exactly the Treasure Valley Canopy Network is?
Definitely. The Treasure Valley Canopy Network started a little over 10 years ago as a collaboration of for-profit companies, nonprofit organizations, and government agencies focused on the benefits of trees in our community. Fast forward to today, and we are a fully formed 501c3 for the last 3 years. And we're focused on planning for planting and growing trees all the way from Boise out to Middleton and all the 9 different cities within the Treasure Valley region.
So with that being said then, Lance, I want to talk a little bit more about trees, as we were just talking with Jeffrey about this, because trees can also lower the temperature of a city, according to research. So how can that actually help with the health of human beings?
That's a great question. And our other guest that's going to be with us tomorrow on the show is Vivek Chandas, who works with both Jeffrey and I out of Portland State University. And he worked with us to do an urban heat study about 5 or 6 years ago. So we actually have an urban heat map that we can show you that shows you where the hottest parts of town are and the coolest parts. And that very much correlates with where there's tree canopy in the hot desert environment, like you talked about earlier. So when it is hotter in the summer and air conditioning is used quite a bit, the people that live in these areas that are hotter tend to have less access to air conditioning. They are going to be more susceptible to health issues. And I'll let Jeffrey talk a little bit about what health issues there are. And we know that increasing shade and tree canopy can help mitigate those high heat days. Jeffrey, can you explain a little bit more about the direct heat impacts to health?
Oh, sure. We know that high temperature can be a stressor for a whole range of conditions. We know that when you have high heat events, we see increased mortality. We see more people in emergency rooms. It's a particular problem for older people. And as Lance said, it's a special problem for people who can't afford air conditioning. So there's a real environmental justice issue there as well.
So, Lance, can we talk a little bit more about this urban heat map that you mentioned? Because I'm assuming then, can you take that map and be like, okay, well, maybe we should plant more trees in this area of a city? How does that work exactly? In particular, as you said, with people living in these hotter parts of the city and they don't have access to air condition. So I'm assuming too, maybe they're not getting out and being physical either because it's so hot.
Yep, 100%. So that is a big part of what the Canopy Network does is we find this data, and this data helps us strategically target our investments in communities. So using the urban heat map, for example, we are currently deploying tree planting programs. The most popular one in Boise is called the Elaine Clegg City of Trees Challenge. And we're planting trees in the area where heat is highest and tree canopy is the lowest. So that allows us to invest in the infrastructure, build the relationships with those communities, and put the trees where they can have the greatest positive impact. We also received in the last year a $1.1 million grant from the U.S. Forest Service, who Jeff works with. And that money is going to strategically go in those areas of all the Treasure Valley communities where the heat is highest and the tree canopy is the lowest.
And Jeffrey, can we talk about another study? This one is out of Portland, Oregon. It found a connection between neighborhoods that plant more trees and cardiovascular disease. So can you talk to us a little bit about what was found in this study?
Yep. I used data from a nonprofit in Portland called Friends of Trees, and they planted about 50,000 trees in yards and street trees since 1990. And what we found is that neighborhoods that planted more trees had lower rates of non-accidental and cardiovascular mortality. And an interesting thing that happened there as well is that as the trees got older and they got bigger, we saw a bigger impact on health, which is what we'd imagine. For example, in the case of high temperatures, we'd certainly expect a mature tree to provide more shade than a smaller tree. And that's exactly what we found.
And I know, Jeffrey, there's a third study that you're interested in. And this one is about how when an insect that kills trees takes over an area, more people actually die of cardiovascular disease?
Yes, unfortunately, this goes both ways. So we plant more trees, we see improvements in health. But when we lose trees for whatever reason, we also see reductions in health. So in this case, I looked at the emerald ash borer, which is an invasive pest that arrived in Detroit in 2002, has been spreading across the country since then. And what we found is that counties that were infested with the emerald ash borer also had higher rates of cardiovascular and lower respiratory disease. And much in the way we saw the tree planting disease, as trees got older, we saw a bigger impact on health. What we found is as the infestation progressed, as more trees died, we saw a bigger negative impact on health. And so unfortunately, that disease, the emerald ash borer, reached the West Coast in Oregon in 2002. So it's probably just a matter of time before it arrives in Idaho.
And Jeffrey, how easy is it to, when you're talking to people, when you show them this research, to convince them that trees really can make people healthier?
As Lance said, I'm pleasantly surprised. As time goes on, people are more aware of these benefits. They see a lot more of these studies coming out. And I should also say that maybe they're not going to find a socially awkward scientist like me that convincing, surprisingly enough. But people like Lance and others who are better at communicating those findings can be very effective. So there's often multiple people in the chain between the sort of soulless number crunchers like me and then going all the way to getting that information to somebody who's actually going to make a difference. And that's ultimately what I'm trying to do. I want to do research that ultimately allows people to make better choices and make the world a better place.
Well, I want to thank both of you so much for coming in and talking to us about this. What an interesting topic. We've been discussing the benefit of planting trees with Lance Davidson, the executive director and co-founder at Treasure Valley Canopy Network, and Jeffrey Donovan, a research forester with the USDA Forest Service Pacific Northwest Research Station. Thank you both so much.
Thank you very much.
Thank you.
As we take a look back at 2024, we're exploring how our climate is changing and how it's impacting our bodies and our health. So let's get back to our series, how we're adapting to a changing climate, right here on Idaho Matters. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Climate change has many effects on our world, from extreme heat to drought to floods, which in turn impacts people and businesses and governments. However, climate change also has a profound effect on our children, especially when it comes to their mental health. Dr. Elizabeth Pinsky is a child and adolescent psychiatrist at Massachusetts General Hospital, as well as the Associate Director for Advocacy at the hospital's Center for Environment and Health. She sees the effect climate-fueled natural disasters have on our kids every single day, and she says the healthcare professionals who take care of our children need to advocate for environmental change. She's joining us now to talk more. Dr. Pinsky, welcome to the program.
Thank you so much for having me.
So can we start our conversation by you telling us a little bit about your climate story, which my understanding is really began in 2018?
Yeah, that's funny. So, I've always been someone who cared a lot about climate change and worried about it. It wasn't until the United Nations report came out in 2018, that year's IPCC report, I had a moment where I looked at sort of the predictions and how far out scientists were predicting it was before we'd see real high risk of climate disasters, even close to home. And I had a moment where I realized that climate change was not this sort of distant threat that would affect my grandchildren or my great grandchildren, but that climate change was really coming for me and for my own kids. It was at that point that I really sort of had my own experience of climate distress or of climate anxiety, where I had a period of time where I worried a lot, did too much doom scrolling, stayed up too late worrying about climate. And eventually decided that what I really needed to do was refocus my professional efforts in that area and sort of align my personal and my professional interests.
So before we get into that professional part of it, can we talk a little bit more about that personal side? Because my understanding is that you kind of saw your son starting to get some climate anxiety. How did you pick up on that?
Yeah, so during that period where I had my own sort of a little bit of a spiral around climate change, I thought that I was concealing it from my kids, that I was doing a good job of not letting them know that I was worried or not seeing that I was thinking about it. And we had one night at dinner where, out of nowhere, my son, who was 5 at the time, said to me, Mama, the earth can never die, right? It's like Santa Claus, and it can never die. And it was like I had sort of been, punched in the gut. I am a pediatrician and a child psychiatrist. I spend my days working with kids who have life-limiting illnesses or who are sort of facing the toughest things you can think of. And in that moment, I realized I really didn't know what to say to my own child. And even more than that, I wasn't sure sort of what to do as he got older and what he was going to need to be equipped with and how I was going to need to prepare him for this future I knew he was facing. And realized that if I didn't know, I probably wasn't the only one struggling with it.
So what kinds of psychological impacts would you say that children are experiencing around climate change?
Well, so when we talk about me and my family, what we're really talking about is climate distress, is sort of worry about climate change. That is not, for most people in the world, the biggest type of mental health impacts of climate change. There are direct impacts on mental health that come from heat and from air pollution. And then there are the impacts of trauma that are related to the kind of severe weather events that we know are becoming more frequent, more severe, and less predictable as the crisis deepens. So things like floods, wildfires, even heat waves can be associated with post-traumatic stress disorder, which I think makes sense to us. If you experience a life-threatening event, you might have some post-traumatic stress related to it. But also things like anxiety, depression, substance use disorder, child abuse, and other forms of interpersonal violence. All of those are increased in the wake of the natural disasters that we know that people are experiencing with more frequency.
Well, and what's interesting to me, sorry to interrupt, but I was going to say, what's interesting to me as you talk about this is, I have 2 children and my youngest is 12 and he has some anxiety already. And I think back on conversations that we've had and he's asked, and a lot of times it is about the earth, right? And I wonder, because our kids are so, there's so much more that I think they see than we did as kids, and right, and so then how does then that play into really what they're seeing, not just on television, but on on their phones, social media, all of those things about the climate, about the earth, and on top of that, we really are in a child mental health crisis in our country.
Yep. How it impacts them is that they know that it's coming for them. They know it's going to impact their lives. And it's a very reasonable reason to feel worried and distressed. We have come to talk about this phenomenon. We talk about it often as climate anxiety. And I have a little bit of difficulty with that terminology because I think for lay people, anxiety often sounds sort of pathological, like it's an illness or a form of mental illness you might have. Being worried about climate change, I would argue, is really a form of health for children. It shows that they are not in denial about what's going on. Anxiety is adaptive. It's what, all animals have to alert them to threat and allow them to prepare for it. Being anxious about climate change makes a lot of sense. I also would say that when we talk about kids worry about climate change as anxiety, as if it's something that, we need to treat or do something about the way they're feeling, it individualizes the problem, makes it about the kid as opposed to being about what's going on. So the problem is not that kids are anxious about climate change any more that the problem is that kids are anxious about gun violence or racial violence or sort of any of the things that kids are struggling with these days. The problem is that grownups aren't doing enough to fix the problem.
So how do we then help our children cope with these feelings about climate change?
So the first thing I would say is that it's important to talk about it the same way it's important to talk about sort of any of the difficult things that happen in the world that we think are important. Our kids want to hear about them from us. They get their values from us. They get their information from us. We should talk to them about these things. And so talking to them in an age appropriate way about what's going on, being prepared for possibly strong or negative feelings, and not minimizing those feelings is really important. Mr. Rogers said, if it's mentionable, it's manageable. And that applies to climate change too. Having a trusted adult who you can talk to about it is important. One really interesting area where we actually have sort of a little bit of data and a little bit of evidence is that specifically collective action. So not individual action, but collective action, the kind of things that youth activists are doing when they join together in peer groups, can be helpful for climate distress, and especially for climate distress if it is linked to actual anxiety or depression. So encouraging kids to take action, but not to take action alone, to take action with their peers is important. And then one thing that I think is really important for both young people and adults is to monitor your sources of media. I always tell people doom scrolling is not actually a form of climate action. It's an avoidant. It is actually an avoidant coping mechanism. And so making sure that you are being thoughtful about what kind of news you're consuming and how much is helpful is really important.
So when you talk about kind of that community movement, but how does that work then with younger kiddos? I mean, I'm thinking like, okay, I've got a 12-year-old and a 15-year-old. What you just said makes sense. But when they were younger, I don't necessarily know if at 5 and 6 years old, they might be able to comprehend maybe that community idea.
When I talk about collective action, I think I am talking more about adolescents and also adults. For younger kids, it's making sure that you're taking climate action, that you're modeling as a parent or as a caregiver, managing your own climate distress and your own climate anxiety, that you're modeling taking climate action, helping your kid build a relationship with the natural world is really important. And again, making sure that you are talking about it in a way that is both age appropriate and honest with your kids. Those are going to be more important for younger children. Younger kids are also natural activists, right? They like to do stuff and get involved and master a problem. So that action piece is easier, I think, for sort of elementary age kids.
So before I let you go, what can healthcare professionals who work with children do to help this as well?
So what I would say is that it is not just mental health in terms of the health impacts of climate change that impact kids more. whether we're talking about, respiratory illness, allergies, nutrition issues, heat illness. They're in every way. The WHO estimates that almost 90% of the burden of climate change is borne by children. So people who take care of kids need to be aware of it, be thinking about it, and honestly, to be talking about it. So certainly in the individual clinical encounter, being sensitive to the fact that a kid might be experiencing climate distress could be important. But more than anything, I think healthcare providers, physicians, nurses are trusted messengers, and that they need to be using their voices to talk about this as a problem and to talk about the fact that ultimately the solution is going to be a just transition off of fossil fuels. And that as healthcare providers, we should be clear-eyed and clear communicators about that, and that it's a health issue more than anything else. Climate change is a human health emergency, and we know what we need to do to mitigate it.
Well, I want to thank you so much for the conversation. It's really enlightening. Really appreciate it.
I thank you so much for having me.
Absolutely. We've been talking with Dr. Elizabeth Pinsky. She is a child and adolescent psychiatrist at Massachusetts General Hospital. Throughout the past year, Idaho Matters took a deep dive into how our changing climate is impacting our health. So how important are trees and green spaces to keeping us healthy? What do the toxins and plastics do to our bodies? And how can we reduce them in the landfill? And what impact does our healthcare system have on our climate? These were all questions that we wanted to explore this year. So we've gathered those conversations together in our series, How We're Adapting to a Changing Climate. So join us as we answer this question and find out ways to make positive change to our health and to our planet. More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Gaudette. Doctors prescribe a lot of things every day, like medications, as well as advice to help their patients feel better. Well, now some doctors are prescribing electricity to their patients. Yes, you heard that right. They believe not having access to reliable power can have a direct impact on the health of their patients. Dr. Anna Goldman is the medical director of climate and sustainability at Boston Medical Center, which has adopted a clean power prescription program. Dr. Goldman, welcome to the program.
Thank you so much for having me.
I have to say, this is a fascinating program, and it is one that you helped put together, and it grew out of watching how some of your patients were struggling when they didn't have access to electricity. So first off, can you just talk about that and how electricity does play a part in healthcare?
Absolutely. So we have been screening for health-related social needs at Boston Medical Center since 2017. And by health-related social needs, I mean non-medical issues that can really impact someone's health outcomes. Things like food security, housing stability, whether someone has access to transportation, education. And one of the things we screened for is difficulty affording utility bills. And this was something I was seeing commonly in the primary care clinic where I practice. I see adults for primary care. And when patients would report this to me, I didn't have a lot I could offer them. In Massachusetts, a provider can provide a letter to patients if they're facing utility disconnection. So if they've fallen so far behind on their payments that they're about to have their service shut off, I can write a letter to the utility that says, please don't disconnect their service. This person has chronic illness, and they will respect that. But it doesn't do anything about the underlying issue, the debt that they're facing, the stress, and it only lasts about 3 months. And at the same time, I was getting more and more involved in advocacy around climate change and working with other doctors to advance policies to help with the energy transition. And I had just joined a community solar array myself for my own home. And I thought, why aren't our patients getting access to this cleaner and lower cost electricity? They're the ones that need it the most.
So before we get to that part of it, can you tell us a little bit about some of the devices and things that patients need when it comes to access to electricity? Like I'm thinking about, like a CPAP machine.
Yeah, exactly. So we prescribe things all the time that require electricity. You mentioned CPAP, so that's a treatment for obstructive sleep apnea. People use it for nebulizers. People have home dialysis machines. They have electric hospital beds, sometimes in their homes, all kinds of medical devices. But electricity is absolutely critical for health, not just because of medical devices. If you think about it, as climate change intensifies, we need electricity in order to run air conditioners. Some people rely on electricity for heat. Many of my patients have reported to me that they have air conditioners but don't use them because the cost of electricity is so high that they don't run them. And then even keeping things like fresh food, fresh food that's healthy, all needs to be refrigerated, fruits and vegetables. You need a working refrigerator for that. You need lights that turn on so kids can do their homework and people can read their medication bottles. It's just a core aspect of how well someone's going to do, whether they have access to affordable and reliable electricity.
And I would think that this is something, Dr. Goldman, that maybe many of us don't even think about is the connection between healthcare and electricity.
Yeah, absolutely. And but it really is, someone's not going to do well if they have no electricity, no heat. They're going to have problems with the temperature in their home and problems just functioning. Yeah.
Mm-hmm. So Boston Medical has solar panels on the roof, and it helps provide the hospital with clean power. So this is just, I think, so interesting. So you and I think some other physicians decided to start actually sending some of that power to patients who need it. I mean, frankly, prescribing electricity to patients. Can you explain how this program works?
Absolutely. So we have 2 solar arrays on our campus. The first one does exclusively provide electricity for our operations. That's at our Brockton Behavioral Health Center, which is actually the first net zero psychiatric facility in the nation. So it's that array is supplying power to that facility. We have a second one that was completed in 2023 on one of our administrative buildings. But when this idea came up of sharing it with our patients, it was reconfigured so that it could actually serve patients instead of the hospital operations. The way it works is that the solar it's called a front of the meter design, which means the electricity is produced, it flows through a meter, and then the electrons themselves just disperse onto the local power grid. We don't know who exactly uses them. It's whoever is pulling energy off the grid at that moment in that local area. But the utility that we are partnered with, which is called Eversource, and they've been a really key partner. So they measure how much electricity we create using that meter, which they own. And then they provide a credit on our electric bill account for Boston Medical Center. And then we direct them to transfer a portion of that credit directly to the utility bills of our patients. So the patients aren't actually receiving the electrons themselves. They're not using the literal power that we're producing, but we are putting more clean, renewable power into the grid, which actually is less expensive to produce than fossil fuel-based power. That's the standard mix on the grid. And then they get a subsidy on their bill from the fact that we are able to produce that cleaner and lower cost power.
So what has been the response from patients who have been able to participate in this program?
Yeah, people are very excited. I mean, we're a new program, we're a pilot. We launched in 2023, but we actually had some delays, and so we finished the array, did the finishing touches more recently, actually getting it connected to the grid. That was the last piece. And we're able to do the first transfer only last month in September. So people just are getting their first bills with the credit showing on it. And, people are really grateful. It is a new idea. It's a strange idea to them that their hospital is sharing energy with them, but it's a chronic stress for many of our patients, and people are grateful to be able to benefit in that way. And many of our patients are concerned about climate change, so it's another way of engaging on that topic and kind of a solutions-oriented way of talking about something that's really a chronic threat to all of us.
So I know you mentioned that you're a pilot program, but is this something where other hospitals, like hospitals in our area, if they were to have these solar arrays, be able to do something similar?
Yes, it is a model that can be scaled, and that was one of the reasons why I was interested and excited to explore this model. There's lots and lots of ways that you can do a community solar model, which is essentially what this is. Traditional community solar is could be a large warehouse with a solar array or a field covered in solar panels where multiple organizations or households or a mix of those are drawing their power from that solar array. A lot of it depends on local regulation in that state. For example, we are able to transfer a credit very easily from our account to our patients' accounts because that's a state regulation that allows us to do that. Not all states have regulations in place that are conducive to that credit transfer, which really is the core of how community solar works. But there are other ways if you're living in a state that does not have that. For example, a microgrid where you're literally connected to the solar and connecting with neighbors and supplying them with power. There's also virtual power purchase agreements where you can even basically get the credit transferred from out of state. So there's lots of ways to do it.
Well, I want to thank you so much for taking time to speak with us today. I think this is such a fascinating program, and I'm looking forward to seeing how it continues. So thank you for your time today with us. Really appreciate it.
It's been a pleasure. Thanks so much for having me.
We've been talking with Dr. Anna Goldman, Medical Director of Climate and Sustainability at Boston Medical Center, which has adopted a clean power prescription program. You've been listening to our series, How We're Adapting to a Changing Climate, where we've been exploring how our climate is changing and how it's affecting our bodies and our health. You can see all our stories on climate and our health on our website, boisestatepublicradio.org. I'm Gemma Gaudette, and this is Idaho Matters.
If you like podcasts like this, explore more from the Boise State Public Radio podcast family. There you'll find a mix of daily news, Idaho Voices, and in-depth series on a wide range of topics. I'm talking wild horses, political scandals, sustainable ranching, and militia groups in a post-January 6th world. Wherever you get your podcasts, just search Boise State Public Radio to find what Idaho's NPR station has in store for you.